Yes, now to our Health Watch this morning, where we discuss all of the topics trending in the medical world. And as always, we are joined by Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
So excited to have you here. We have a couple of topics to dig into. So first up, former President Joe Biden recently had a routine physical exam, and doctors uncovered a nodule on his prostate. So can you tell us what causes that growth, and what are the steps people would need to take after that if it's discovered?
Sure. So I want to talk about a couple things with viewers here. First of all, this spectrum of, okay, if there's a prostate nodule, what does that mean? So it could be anywhere from benign to more serious. Okay. And so by benign, I mean it could just be as a result of inflammation, which is common in as you grow older, as men grow older. It could be because of prostate enlargement. That's called benign prostatic hypertrophy. It's a common condition as men grow older. Or more ominous, it could be due to cancer. Mm-hmm. Now, in the former president's case, I'm not exactly sure what prompted the prostate exam. By general guidelines, it's not really recommended unless he was having, symptoms related to urinary retention, or, there was a test that was done, a blood test in particular, looking for signs of prostate cancer that came back positive, that prompted the doctor to do this manual examination, where now what next step would be to have a more informed discussion with the president and his family because of his age. He's 82, which basically means above the age of 80, almost 50% of men will have some degree of prostate cancer, some stage. And prostate cancer is very slow growing. So that's the next step that the discussion needs to take place. Do we actually do the biopsy and find out definitively what this nodule is, or do we just wait and watch and observe?
Right. Okay. Now, the next one, there's a new study out in the JAMA Network Journal that says children are at increased risk of high blood pressure if the mom ends up having some health complications. Yeah,
this is an interesting study, Symphony, because it can have implications on public health, on how we treat or screen women of childbearing age. So this study looked at about 12,000 women and their offspring for a many number of years, and they looked at three important conditions: so obesity, high blood pressure, and diabetes. And those conditions in pregnancy correlates to higher blood pressure in children, not only at birth, but even up to age 18. Which is significant, because we know not controlling these risk factors early on can lead to poorer cardiovascular outcomes later on in life for children. So more studies, more investigation is needed, but nonetheless, it is very interesting. It goes on to show the importance of screening, especially in pregnancy, controlling these risk factors in pregnancy with medications and such.
All right, now let's talk about weight loss drugs. A lot of folks are into receiving those weight loss injections right now, but it turns out there's one particular shot that may be more effective for some folks.
That's right. So this is the first study looking at two blockbuster weight loss drugs, Zepbound and Wegovy. And the study looked at about 700 or so individuals who were on these drugs. And Zepbound was seen to, at 72 weeks, was seen to have a 20% loss in body weight for individuals compared to 14% in the Wegovy group. Now, I don't want viewers to start thinking, okay, now we all have to move to Zepbound. No, we need these drugs in our arsenal because one drug may suit someone and the other may not. And there, we know Wegovy, for instance, per studies, has a 20% reduces risk of cardiovascular disease by 20%. So suffice to say, it's interesting, but please make sure you have a discussion with your provider, who if you are taking one of these weight loss drugs, to understand which one is the best for you.
Okay, thank you so much for joining us this morning. Now, as always, if you guys have a question you would like to ask Dr. Hussain for our Health Watch segment, you can send it to us. Just text the keywords Health Watch, it's on your screen right now, to the phone number 860-527-6161.